Good evening, ladies and gentlemen. A very hearty welcome to you all to Dr. B.K. Kumar Memorial Oration being organized by our HMAT. So, on this occasion, on behalf of the association, we pay our heartful homage to Dr. B.K. Kumar Garu, and we also thank the family members of Dr. B.K. Kumar Garu, Srimati Ananda Gauri, and other family members for sponsoring this event, and they have been doing a great service by promoting this event since so many years. We profusely thank them, and I thank one and all for having come here to participate in this event. Today we have eminent people to speak. Shilpika Turakhia, Anthroposophy, Art of Therapy faculty. So, hearty welcome to you, madam. And Sri Ketan Turakhia, hearty welcome to you, sir. And Krishna Priya, hearty welcome to you. So, we are going to hear from these very eminent people. So, many new aspects of therapeutics and how we can help sick people or people who are in pain. So there are various auxiliary methods available, of which Dr. Hanneman also mentioned very specifically. So to hear them, we are eagerly waiting. So we profusely thank these eminent people for having come here to deliver a lecture and obliging our request. Thank you very much. So I once again thank the sponsors and pay heartful homage to Dr. B.K. Kumar Garu. Thank you.
Thank you, sir. Now I call upon Dr. Raghuram, sir, to deliver about HMAT.
Respected President Sir, Dr. Gopal Krishna, Sir, ICRH Clinical Director Dr. Venugopal Gauri, our beloved speakers of the day, Ms. Shilpika Turakia, Mr. Ketan Turakia, and Ms. Krishna Priya. Other distinguished guests, governing council members, Mrs. Ananda Gauri, daughter of Dr. B.K. Kumar, and doctors and everyone. On behalf of HMAT, let me pay our heartiest tributes to Dr. B.K. Kumar, on whose name we are organizing today's event. A CMA program on autism, ADD, and ADHD with auxiliary modes of treatment. We profusely thank the family members of Dr. B.K. Kumar for their contribution in holding the event. At the outset, let me give you a brief note of the various activities of HMAT. As all of you know, under the aegis of HMAT, Dr. C.L. Modi Charitable Homeopathic Dispensary, the OPD service are being carried out for more than 5.5 decades. Besides OPD, there are various other specialty clinics like ENT, skin, gastroenterology, ortho, diabetes, metabolic and lifestyle disorders, behavioral problems in children, pediatrics, infertility, urology, and others, which are being attended by senior most homeopathic physicians. Apart from the medical service, we also train interns posted by homeopathic colleges to hone their skills and improve their clinical acumen. ICRH, the Institute of Clinical Research in Homeopathy, an academic and research wing of HMAT, there's a vast clinical data compiled by our OPs and specialty clinics for the future evidence-based research activities. The monthly orations throughout the year, that is last Sunday of every month, in the name of the noted persons, by inviting expert doctors offline and online, are a model of CME for practitioners and young doctors. The same program we have been doing outside HMAT also at various homeopathy colleges to encourage their participation and involvement. During every epidemic, our epidemic cell doctors distribute free homeopathic preventive medicines right from brain fever time to recent corona pandemic. Periodically, we conduct state and national level seminars by inviting experts from all over India. All these are possible with the support of all members and philanthropists who are helping in this cause for decades. We thank them for their cooperation and generosity. Last but not the least, we thank our honorary physicians for their service and commitment in successful running of the OPD and specialties. The HMAT is thankful for the resource person of Dr. B.K. Kumar's memorial oration who are going to share their extensive knowledge in treating autism, ADD, and ADHD with the help of oxygen modes of treatment. Thank you all.
Thank you, sir. Now I request Dr. Savita ma'am to please introduce our Dr. B.K. Kumar Memorial Oration to the audience.
Good evening, one and all. It's my great pleasure to speak about Dr. B.K. Kumar, sir. So, Dr. B.K. Kumar was born on 16th January 1916 to Sri G.B. Ramachandra Rao and Srimati Alvalamma. Sri G.B. Ramachandra Rao was a poet in the court of Gadwal Rani. Dr. Kumar was a student of St. George Grammar School and graduated from Nizam's College that was affiliated to Madras University. He served the education department as a teacher, headmaster, DEO, and deputy secretary in Zilla Parishad. Right from his young age, he had great passion and love for medicine and had a special liking for biology, though he had graduated with maths and physics. Later on, he had studied homeopathy and become a registered medical practitioner. He practiced with full dedication, confidence, and devoted his spare time treating the patient free of charge for more than 5 decades. After retirement, he had devoted his full time treating the patient at the clinic and at home also. He was also associated with Andhra Pradesh Homeopathic Association, that is today's Homeopathic Association of Telangana, since its inception. He was an honorary physician and served and associated himself with homeopathy till the end. He was a very disciplined man. He was very sympathetic and had a lot of patience while dealing with patients and people around him. He was 79 years when he breathed his last on 22nd November 1992. Thank you.
Thank you, ma'am. Now, as Ananda Gauri ma'am should leave early, we request all the dignitaries and all the team members of HMAT to felicitate our sponsor of today's event, Dr. Ananda Gauri ma'am, with bouquet and shawl. Ma'am, please come on to the dais. Your presence is very valuable for us. Please welcome ma'am with a round of applause. Even in this age, ma'am made up and came and attended the session. I request all the speakers, everyone to please join the felicitation. I thank all the dignitaries. Thank you so much, ma'am. It's a great honor you have come and attended the session. So without any delay, let us start our today's oration, Dr. B.K. Kumar oration. So today it's something unique. Every time we'll be seeing different topics, different approaches, but today it's something like an integrated medicine. It is like different doctors coming together. Like you can see anthroposophy, you can see craniosacral specialist, then you can see a psychologist. So it is something which is unique, and I request all the audience to pay full attention to understand the subject in detail. So before we start the session, I would like to introduce all the speakers of today's oration. So first of all, Dr. Shilpika Turakia ma'am. So Mrs. Shilpika Turakia ma'am is a biography analyst as an integrated listening system therapy from Integrated Listening System USA, and she has graduated from and she is further trained in art therapy from Swastika Niketan, Bangalore. And she also has a degree in anthroposophic art therapy, play therapy by Rudolf Steiner Maskelyne, and anthroposophic art therapy from European Academy. She is certified extra lesson practitioner from the Extra Lesson Institute Private Limited, Australia, and she has a bachelor's in fine art from Sri Venkateshwara Fine Arts. Her skills are art therapy, clay modeling and music therapy, counseling, working on missed milestones and reflexes, and assessment of children with special needs. And her professional journey, if we see, she is currently faculty training in anthroposophical art therapy, and she's training teacher in different schools in the following sectors, like currently working with all age groups for extra lessons, ILS, biography analyst, and art, play, and music therapy. She is working as an art therapist with Delphis and Antarya Association of Anthroposophical Psychotherapy in India, and she worked as extra lesson practitioner at Kshetram. And she also worked as craft, clay, and painting teacher at Kshetram Special Needs School, training children for NIOS painting. Now, let us speak about Mr. Ketan Turakia, sir. Ketan Turakia, sir, he's like a specialist in craniosacral therapist, and the human body has a powerful inherent healing potential, but this potential can be compromised or gets depleted due to injury, disease, trauma, and even stress. Craniosacral therapy helps body to restore this potential and navigate it in a better way. Craniosacral therapy is a gentle hands-on method of evaluating and enhancing the function of your craniosacral system. The physiological body system comprising the membranes and cerebrospinal fluid that surrounds and protects the brain and spinal cord. CST potentially allows your body's natural healing processes to improve the function of the central nervous system, dissipate the negative effects of stress, enhances health, and strengthens the resistance to ailments. Now, our next speaker is Ms. Krishna Priya ma'am. She is a consultant therapist with expertise in diverse areas, blending her knowledge of psychology, business administration, and commerce. She began her professional journey dedicated to providing support to neurodivergent individuals. For 4 years, she worked with children, teenagers, and adults, offering not only direct care but also counseling support to their parents, thus providing a holistic approach to the family wellness. She is also consultant therapist at Pause for Perspective since July 2023. Her practice focuses on addressing a wide range of concerns such as relationship issues, anxiety, depression, self esteem, and confidence. She incorporates queer affirmative counseling, neurodivergence understanding, and narrative practices into her work. And if you see her educational background, she has a postgraduate diploma in counseling skills from St. Francis College for Women. And she has an MA in psychology from Indira Gandhi University, and she has a postgraduate degree diploma in business management, Institute of Public Enterprise. And she also has a bachelor's in commerce, Bhadrika College of Commerce. So we extend a warm welcome to all the speakers, and we request you to present today's topic on autism, ADD, and ADHD and its auxiliary modes of treatment. Thank you.
वैक्सीनेशन के बारे में
A warm welcome to all. So I would request,
मैडम इंट्रोडक्शन करो
everybody can stand. I want you all, ma'am, if you not able to, please, you can manage sitting. So I want you to experience something. That's where I had requested you all to stand. I want you to relax yourself, relax your hands, relax yourself. A nice good breathing, a deep breathing, breathing in
Hot.
and breathing out. I would like you to stand on one leg, any one leg, little more.
तो करा शिल्पा
I would like you to stand on the other leg.
एकल थेरापी कृष्ण प्रिया narrative and practice.
I would like you to close your eyes. Maybe one leg you can stand on. Close your eyes and stand on one leg. That's finished. I would request you to stand on the other leg. Close your eyes and open your eyes. Yeah. Yes. Anybody else wants to talk about it? Yeah. Just so we talk here about extra lesson. Before I start, I have an example of how our balance is connected to yours, where we stand upright and we feel what we are doing. Animals cannot stand upright. They do not feel that there's and we speak because our speech everything is connected standing upright. So it's about what is extra lesson. Extra lesson is developed by Macmillan. That's it.
Karachi. Reflex Child Development Part 2. What models?
Dr. Khalil, Dr. Durga Prasad, please mute your mic.
Might take over. By mistake, click on that meeting group structure never prepare the speaker. Okay. गड़बड़ हो गया Yeah. कहीं को दिल कर दो पहले. Rolling. Rolling. Lateral coordination, panel fingers and put two hands and posture stability. Without support, top but fall to as you cover offensive blocks, perform vertical strokes, parent systems, heavy particles. Writing is 3, writing. Okay. Okay, behavior उसका पूछना अरे अतन समझा क्या ठीक है कॉलेज का नॉट अवेयर तो देती है आप देते हो सीओपीडी बताओ आपका स्क्रब ऑलरेडी सेपरेट सब कर लिया development of moment balance taste body geography body space learning lesson explore that's reading reading writing
If I do not have and I have confusion between my right and left, I would have confused person as an adult. So when my 0 to 7 is not 0 to 3 is not integrated very well from 0 to 1, we are looking at the physical abilities of the child, where the reflexes are retained and the milestones have to be done with various helps like environment, food, medication needed, or various methods which we understand are being not done can put the child in difficulties with ADHD, ADD, and dyslexia, many more things. Now, extra lesson does not judge anybody. So we do it in more holistic way where our assessments are not that we do conventionally. Conventionally, you have a regular method where you have a checklist ready and you tick. For example, eye contact is not happening. Your child is even branded into autism or ADHD. Not sitting tolerance, you might put it into other branding like child is very very hyper. We just look into what is the milestone left, what is the difficulty with eye hand coordination, or the child is having the sensory processing difficulty, which reflexes retained, so that everything together can be helped out in various methods to help the child get into consciousness. So generally we use extra lesson and ILS as a program together, which helps not only children and an adult. I work with any age group to help them make aware. It's developed by Dr. Stephen from USA. This is quickly helping your sensory, your vagus nerve, and your whole neural pathway, neuroplasticity to develop. Externalism is working on the physical body where you don't come back with your difficulties when you are integrating the whole reflexes in you. So here we are also looking into it develops. So how is ILS helping? ILS is a music system which is put on the head and has a bone conduction and air conduction with the music and the different frequencies which we program what is needed to a child or an adult. So there is a simple assessment to understand what is the requirement. Even if you have a hearing difficulty, we would go for a hearing test, and then we have a program which side to be adjusted for the hearing to develop with the neuroplasticity helping, and then we give the program. So this and exercises gives a good help where you see the confidence improving auditory, visual, taste, balance, hearing, coordination, fine motor, gross motor. So these exercises and music together with extra lesson has a specific paintings which we do along. So it is like again working on the mind, body, and soul, helping the auditory integration, movement, and more activities which are being put in the ILS. Also, we're trying to train along with it with different exercises where speech, cognitive process, language programming, many more things are being added in so that the child is able to speak if their child has a speech difficulty. So most of the time in conventional way, breathing, movement, and your speech is simultaneously going on, which is not being taken care of. We take it as a different, path where we are putting sensory is different, or we put cognitive process as a different thing, reflexes are different things. So we just brand it in a different way and not put all the things together. So Extra Lesson gives a beautiful program where everything is in one place to help sensory with ILS. So we see lot of changes within 2 to 3 months, even with an adult. So benefits again with ILS, even if you have not done exercises, sleep, breathing, move, your memory, stress calming down, your rhythm, your movement of speech, sensitivity with sound and light will reduce, even if you're not doing other activity along with it.
Class. Yeah.
So I would like to take art therapy as we all only talk about health connected to physical elements. We only talk about health connecting with, we may brand it with ADHD, ADD, different names, not understanding, how mental illnesses and the physical illnesses are important, but why it is come. This is because of your soul process, which is not being understood.
Okay.
Something which is very important is art therapy is artistic therapy or art therapy is deeply into understanding of medical work. We have been trained to learn Uthyanam to understand why and where I am supposed to implement which kind of a painting. So there are different methods, and this is also again works on the principles of Rudolf Steiner, but different people have worked on it, like Gerard Wagner. We have Hauta's method, many more methods, which helps us to understand. So it is used in curative special needs. It is used for remedial education in different schools. It's when while painting, it's a silent language for you to understand what goes through inside you. It's a relationship between the light and darkness where you feel where you are, who you are, and what you do. So this is again connecting. It works on the principles of illness and to deep roots of what is happening in the soul process. Color experiences are processing through the breathing. It makes your breathing more aware, makes you more conscious, makes you more calm. It makes you understand what you go through. So emotions and feelings are being helped, and we regulate it with the breathing, understanding where and how it is being coming. So again, it is a holistic method to work on it. So colors are again very, very individual. Each color has its own importance, and you feel the color while you do it. We have various methods of doing, like whale painting, wet on wet painting, charcoal painting. We have maybe a slide, maybe when I talk about it. Yeah. So we have colors are not very clear. So we have plant-based colors. Naturally, work with, because we work on illnesses, we are supposed to work with etheric colors, natural colors. We maintain a lot of organic things around. We do not use plastic and many more things around. So we do wet on wet painting, so which helps you to more feel a losing method. So when we do, for example, if you see, there is a weight when you paint. When you paint at the bottom, you feel a weight. So there is a weight, measure, and the color, which gives you movement and understanding of why are you doing that painting. So each painting is for a different purpose. Also, when you paint, there are rainbow colors we are not seeing. So rainbow colors connected to your chakras. Rainbow colors also connected to your environment around. So when you see the center, it's your sun, which is in orange, red color, red is orange, and you see a orange around it in the red, and you see a yellow around it, and you see a green, which is around it in your environment, and then you see blue, which is your sky around it. Down you see a grounding, which is brown. This is an archetypal pattern, which is inside you, which you see outside in your environment. So it's a little different method, and it's a very beautiful way. I think only when you take an experience, you understand what I am talking about. So generally, we only talk about, physical elements and mental illnesses. We never talk about soul elements. So what happens? We are only bothering and talking about the head. Too much of thinking, sensory bombardment, or whatever goes on in your mind. We are only talking about your metabolic system, your health, your physical abilities, your physical issues. You go to a doctor, different ways we're trying to help, but nobody understands how important is the soul. We have two polarities of your nerve sense pole and your metabolic pole, which is not integrated well until I don't have consciousness here with my rhythmic sense pole. So it is very important to take care of your rhythmic system, which takes care of your nervous system and your metabolic system. So these are clays. So even the clay has different variations, how to do, what to do, how much to do. So we have organic methods, we have yin yang methods, we have metamorphosis in different ways, from the trees to plants to mother and child to spiral to, and that's a few example of etching. Dynamic drawing, form drawing I haven't put. So these are all integrated methods of using. We use it on all kind of difficulties and diseases too. And we have been, so we are recommended to work under doctors of anthroposophy. So we work with cancer, tumor, and other diseases too.
No, what he said, I'm asking.
So here I take a break. I would give you just 10 minutes of 5 minutes. So physically, I would like you to draw and feel what you actually go through when you're drawing. We only use head, we only use, hand, but there's something that you miss out is your heart. So please try to remember every time, whenever you do, don't use only your hand and body and mind. Use your soul, your rhythmic system to help yourself, which keeps you in balance and gives you a lot of harmony. It's a root cause of a lot of diseases, emotions. Yellow and blue. I would request you all to take one yellow and one blue. If you can manage taking the other side of the chair. Or if somebody would like to come down and do it on the tables here. एक paper. Yeah? No. Thank you. केतन के पास है उसमें नहीं होगा So instructions, I would use yellow. I start drawing from the center, keep moving top to bottom, side, right to right, keep coming to your center. I want you to stay, keep coming to your center. I want you to feel and experience what did you feel when you moved.
Once more, repeat.
While drawing, take yellow. I want you to draw. Start from the center. I want you to go right, left, up, down, but please come back to the center. Relax. I don't want you to do it stressfully. Enjoy your painting. Keep coming back to your center. Become aware and conscious about your breathing. Move left to right while drawing. Go up and down. Keep coming back to the center. Once you feel you have done, I want you. Once the yellow is done, you feel it's enough because yellow is difficult to control. It keeps moving out. So that's the individuality of color. I would request you to take blue and start drawing blue from out to in. Out to in. Yellow was in to out. Blue is out to in. So I want you to relax and do it. As you have finished doing yellow, which keeps moving very quickly, I want you to use blue. Paint from the edge of the paper and come to the center. Keep breathing.
Keep breathing. Blue is coming from out to in. So I'm sure many of you must have drawn after years. What forgotten what is drawing. So our culture has colors, our culture has a lot of integrity of, how we work with mugus, form drawing, we call it as form drawings, which is for intellectual health. It's good for putting mandalas in front of your house, which works on dementia. So why people do it is a reason for doing it. Thank you. So here we talk about when you paint, we are drawing yellow. Yellow is every time a very happy color, but it's a very quick color which you can't hold on. So that's, it also talks about your temperaments. And blue is very slow. It's very hard to move. So I'm talking about individuality of color. So do we are. Yellow is, blue is different, green is different, red is different, and our natures are connected to it. So imbalance in the colors is imbalance in our energies, also an imbalance in my soul. We all need to be in a balance with a harmony of all the colors within. So color play a very important role where we miss out. So art therapy is not just healing your heart or soul, it's also healing all your illnesses, including cancer. It makes a very big difference. So it's like breathing and breathe out. We had very quick session, doing with paints with wet colors would be a more beautiful feeling where you feel expansion and contraction. Breathing, breathe out. With the breathing, you feel your heart. It goes on very slow. It gives you a complete experience of what you're doing. So we have various methods, again, etching, form drawing, what is required for the client or whatever the illnesses they have come. So biography counseling and art therapy plays a very important role. Biography is again based on Rudolf Steiner's principle, but we look into what can you work on your own self? What and how you understand why are you, who are you, who am I? There are different questioning coming with a different age, and it happens archetypally to everybody. There's no difference when I say biography, it is been well planned how it has to be taken care. So we look into what happens at 0 day, and the planet which we come through is moon. Then we look into what happens with after the 7th year, 9th year, which is very, very important. We call it as Rubicon age. In Indian system, it is the puberty age. Connecting, we do grand ceremonies like Jenevu, Dhoti, puberty coming in and welcoming your adult. Also a marking of physical body and your etheric body finishing, and it is taking you to your feelings and your puberty to understand how you are growing, how do you understand. In our system, it also talks about how your karmic pattern starts after your 9th year. It's included in your karma. So we work on the patterns of whatever age group you have come. For example, I am with the age of Jupiter, that's a knowledge wisdom period, but I would reflect, I'm also reflecting my age of 7 to 14. So where something comes up with the diseases or your physical illnesses, mental illnesses, and emotional illnesses are being taken care to understand where they are coming out from. So we have a more detailed knowledge which we have been taught, the midline crisis, which is 3.5, to make you understand what happens on the other side and what happens now when you are coming with whatever you are going through. Because it's a very big subject, biography itself, only experience can tell you. And there are many more questions to understand what is biography about. Yeah. Do you want to have any questions regarding anything which we have just finished? I know it's a something, new topic for you all, and it's okay. So let's move on.
Wonderful. Very nicely done. Very nicely done. Very good evening to one and all. I'm practicing craniosacral therapy, which is an upgraded version of what we have been listening and seeing in mythology, that how energy works and how it helps people heal, even when they are at distance or even when they're sitting together. Yeah. So we typically we work all together, all three of us. So my role is very different and small compared to what Shilpika just mentioned and showed all. I relate to only one subject, technosacral. Typically, that is where the whole life force of the body runs between our cranium and sacral of our body. The major fluid is developed and which flows through the body is all through the cranium and sacral point only. And major of the issues we resolve normally when we talk about autism, ADHD, and ADD, when we connect with those kids, actually in their brain area. We have seen a lot of changes, development in how this craniosacral therapy helps. Typically, this energy, this work is more of experiencing rather than talking, what Shilpika did. So my work, I would always, invite whoever is available here to come and take a free session for me to understand how this works. This is purely energy-based work. Part is, we do not absorb anybody's energies into our system when we are giving them a session. So typically, we just touch the person on our table and allow the body to down in terms of mental stress, difficulty, or physical aches and pains.
The body nasal mobility, hands and upward.
Hello.
Generally.
I have seen kids taking this up, other than elders, and we have found good results out of what people have taken from me. There are a lot of therapists practicing this across the country and abroad. This is something which every individual need not have a difficulty to experience it or go for a session, but should experience it and go further with it. So typically, as we have written here, it improves your body rhythm, mental rhythm, and emotional rhythm, which is normally off now for everybody because of the digital platform which we all are going through off late. We are not able to move around without a mobile in our hand. We are seeing a lot of stress. When free, we are either looking at our mobile or connecting with something, and we are not able to be in ourselves. So this is an area where craniosacral therapy helps a lot to improve one own self as an individual. Now, these are the areas where we work with and how people get benefited or who all can get benefited out of it. So my youngest patient has been 2 months, who was quite colic. I've had early age kids, hyperactive, autistic kids, not sitting in one place. And I've got one or two images which I'll show you that during the session, how they reacted after the session. So it really helps a lot in settling down emotionally, mentally, and with physically also. It's typically where we don't apply pressure, we don't go to any nadi work, we don't go to any pressure points. We just connect in a very simple and a light touch and allow the body to process what it has to reflect. Now, these are some of the areas where it works very well. It reduces one's stress and anxiety. It helps in chronic pain. The sleep is improved. I've had people who are stressed or who are depressed or who are suicidal. I've had those people also. Down the line, few sessions, they said that they are doing better and they just stop in between because they feel they are doing better. Normally, which is not the case, we say that they should continue till we feel the right time has come for them to stop. This is one thing which you all ignore, that, I am doing good and I don't need now anymore. Headaches, body aches, all kind of body aches are taken care of. Typically, this is how a patient is kept on a table, asked to lie down on a table, and the therapy is performed. So we just give them a subtle touch and listen to their body. Very silently and peacefully, very peaceful space. We just, try and listen to what your body is saying. How is it reflecting? We end up reflecting by whatever the body is saying. Like we have seen people saying that, when I have had sessions with people, I tell them that, I'm reflecting, I'm seeing fear in your body. So that's when they end up saying that, this is what I've been going through in my personal front. So we don't really, probe more, but then yes, we are available for them if they wish to speak out, but we allow the body to process what it has to reflect. This is again one more image where it's shown that how newborn babies or pregnant women should also take CST, how it helps. Unlike earlier days where a woman who's pregnant was always indoors, was taking care of her health, food, sleep, diet, which is no more a case now. Which we see till the 9th month and the last day of the pregnancy, the woman is working today. Going through a lot of stress, professional front, maybe, or even a personal front, we don't know. But we see a lot of stress, what they build up reflects in a newborn, which people do not understand today that, that's a stress which a mother has passed. And a doctor says that whatever mother eats is what a child also absorbs. The same way, stress, whatever mother has taken, that is absorbed by the child. We see, though we are seeing a lot of artificial birth now, typically they are not allowing natural birth anymore. That has become an industry by itself. So C-sections, we are seeing a lot of kids being, forceps babies. We have seen taking sessions and we have seen their structure of their skull coming back to the aligned, what actually it has to be. Because of forceps, the change of the structure is there in their skull, which is again normalized because of CST. These are a few images where this girl typically, she's about 4 now. So she is very difficult to handle. She has been quite off track, not connecting with anything what we say. So initially, it was very tricky. Now, again, the role of parents as a family comes in where the diet is not taken care. Any child who's ADD or ADHD or autistic or in a difficulty, one thing what every individual has to understand is the diet, the surrounding of the child. These two things are not taken care. How much ever they go to therapies or we give therapies, the changes will be limited and only for a limited time, which is a very important aspect, which as an individual, every parent needs to understand that the surrounding has to be very calming, peaceful, and amicable for the child to accommodate itself. That is where we can see a wonderful transformation to the child, developing into a better human being and settling down with their own difficulties. Now, parents saying that this child has never slept in the day and even the night, she sleeps by 11, 12 and is up as the sun rises. And she doesn't sleep throughout the day is the change after she started taking my sessions. So during the session also, she just ended up dozing off. And we had to allow her to sleep after my session and ask the parents to allow her to sleep and let the body process. The more sleep or rest is taken post sessions, the body process a lot and every individual has seen a lot of difference in their upcoming, whether it is emotional, physical or mental. So before I finish, I once again invite each and every individual to connect with us, experience what we do. Yeah, we won't be charging you for the first session. Thank you.
Hello. Okay, before I go ahead into my presentation, I want to take 2 minutes of my personal story, why am I associated with Shilpika and Ketan. Personally, I have a ADHD child and I'm a conventional therapist by myself. I practice conventional therapies. And my child goes to a Waldorf school where they believe in alternative therapies. And that's how I got connected with Shilpika and Ketan for alternative therapy help. So I've sent my child to conventional therapies also where BT, OT was taken care for some time. But the moment I paused and when I took a break, I saw him going back again to the same symptoms which were showing. And when I started with Shilpika, school insisted on me going for this other therapies and try. And that's when I started my journey of exploring what is extra lesson, what is ILS, and how art therapy will help or how cranio will help my son. And that's how I got. And my son has done pretty long term therapy with them. And now he's like 16 years. He started when he was 11. He did for 1 year with them. And now I see him very settled. Like subtle things like drawing a straight line, cutting paper with scissors was difficult. And trust me, after 3 months of taking this therapy, I saw him doing it on his own. And that was for a mother. It was like, I'm done taking care of him. So that's where I started my journey with alternative therapies. And how I integrate my therapy with these things is first is let's understand what is neurodivergence. According to me, neurodivergence is simple thing that people with neurodivergence, their brain function differently. That's how I see a neurodivergent individual. And now what I do with my awareness of neurodivergence is I help a client coming to me accept their symptoms and empower themselves with this help of therapies or coping skills which we can have, which we can use and help us function like every other person along with us. So one of the practice I have is narrative practices. Narrative practices is just, I think 40 years back, it just started in 80s, where it mostly talks about think ourselves as we all have our stories. When as a child or as an adult, when we listen to the stories and start repeating ourselves the same thing, we believe we are the same. Like if I constantly say I'm a shy person, unknowingly we are practicing it without even our knowledge. So as what am I doing as a therapist when they come to me? We sit with the stories. From where it's starting. Why do you feel? How do you know that you're shy? How do you think that is reflecting in your daily work? That's how I start connecting when I'm starting with stories. And then we try to understand whether it's a parent which is reflecting you that you're shy, whether it's a teacher which is reflecting you're shy, or it's you yourself is building this story for yourself that, okay, I am not able to be like other person. That's why I'm considered it as shy. So I am myself labeling that I am a shy person, but it might not be. Might be that is something I'm difficult and I need to work there. That's the story change we bring by talking to the therapist. Sorry, to the client. That's how narrative therapy works. Now, what are the core principles of narrative therapy? Is your life has a story, like I said. There is one dominant story we all carry, like I am shy. But there are other multiple stories which go along with the dominant story, which we never give a importance. So I try to discover those alternative stories that each client carries. And then I try to connect with their goals, beliefs, and all. And that's how I bring up the new stories for them to become functional in the areas where they feel they lack. Externalizing the problem. Now, how do I see? Now, continuously when I'm saying anxious, that is the problem I'm carrying. But I try to externalize it. I say, anxiety is bothering me. Where I'm bringing, I am an anxious person too. Anxiety is something outside me which is bothering me. Now, how it's bothering me? How can I help myself not to bother me is something where I bring the problem to externalize it. Now, exploring your strengths. Now, I work like person is anxious. To come here to talk, for me also it's an anxiety thing because it's something I don't do regularly. I am in a room where I'm only with one client and I'm comfortable in that space. So, but I tell myself, I give this affirmation that I'm anxious, but I still manage to present in this hall in front of so many people. So that's how I try to pick up their strengths. That's how I build these stories for the clients that yes, this exists, but still we managed. That's how we build strength to each client, and that's when these new stories help them to do things which they never did. So that's how I rewrite the stories for the clients. Then challenging outside influences. When I say outside influences, they can be social, they can be systemic, they can be cultural, they can be family, anything. So we try to pick from where this outside influence is happening for us to believe that this is me. That's how narrative therapy helps us. Seeing problem as separate from ourselves, understand the stories you have been living by, focus your strengths and moments of success, and create new empowering stories that guides your future. This is in brief about narrative therapies, which I practice. Now, how I help narrative therapists become a part of their life is by mindfulness practices. Now, what is mindfulness? It's just simple that we help the client to become aware, present, and accept their own thoughts, emotions, and sensations. That's what is mindfulness. Now, present moment awareness. It's simple. What I'm talking is I'll try to be present here. I shouldn't be worrying about my past and not about my future. So I try to bring the client more to the present by asking them, what is happening to you now? What are you feeling? What is the body emotion that you're feeling now? Where is that you're feeling now? That's how we bring the client to the present. We have other exercises which we help them to come to the present. So these are the ways mindfulness happens. Non-judgmental acceptance. Now that is simple. When I say non-judgmental acceptance, when I do something, the first thing we all question is whether this is right or wrong, whether this is good or bad. Like why? Why is that you always want to judge yourself whether you're right or wrong? Sometimes it's just that my body needs it or my mind is seeking it. What it is. First understand why is that you want to do instead of judging yourself. That's how we bring to it. Which all this helps in our emotional regulation, where we are helping the client to understand what's the emotions that they're carrying. Then increase self-awareness. All these are byproducts of mindfulness practices we do. Now, how we do? Breathing exercises, which will help us to calm down. Body scan. Body scan is such a mindfulness practice. We take 30 to 45 minutes time of the client, where we are taking the client into the journey of knowing each body part in that moment and asking them to notice those emotions so that we know what is happening to us in that moment. Meditation, and then grounding practices. Now, what are grounding practices? Simple things like to breathe, go outside for a walk, make a meal by yourself, or journal, or meditate, move, rest, clean our clutter at home, or just go play something. These are simple grounding techniques which will help us to be in the present. And the last one is mindful observation. Like I'm talking, when I'm eating, nowadays we all don't bother to even consider what we are eating. We're just engrossed in the Netflix or Amazon. But we are just asking the client to come, sit, eat, feel what is the texture, what is the taste, what is the smell, which is more being in the present. The other part of my work importantly lies with psychoeducation. Psychoeducation is nothing but educating the client and their family or the guardian or the support system they carry to know what is the client is actually having, the difficulty the client is actually having. So we try to educate the client's family about the mental health challenges they're going to have, the conditions or the coping strategies, or has their support system, what they can do to help the client to manage their functioning. So main is to empower clients by enhancing their awareness, then reducing stigma. Stigma is very crucial part of psychoeducation, where all of us are so tamed into thinking that this is bad, this is bad, this is not right, I'm not normal. It takes a lot of time for a therapist to unwind that belief for the client. Then promoting self-empowerment, then technical skills and strategies for coping and self-regulation. Enhancement treatment adherence by helping clients understand the rationale between therapeutic interventions, medications, and lifestyle changes. This is something we all struggle because no client understands why lifestyle change is important to bring that balance in the body. And how we all have this notion that if I start using medication, I'll be getting used to it. I don't want to take medication and I don't want to take therapy because I might not be able to stop using those things a later part in my life. But it takes a lot of time for us to make the client understand. Might be this is temporary. Once you learn strategies to cope with yourself, we can slowly wean off one by one. So these are the things which we try to also educate client that medication is not a lifelong thing. It can be a temporary thing, and the lifestyle changes is very important. And interventions are like something like grounding techniques and all we try to teach the client. Now, articulation of emotions, feelings, and thoughts is a last part in therapy. Like once I'm able to help the client to understand what am I trying to bring to them, is when I finally ask them, like, identify the emotion, what is happening to you. Like most of the clients know that something is wrong, but they don't know what is wrong. And sometimes we mislabel our emotions. It might be anger, but we might say it as disappointment. It might be sadness, might be say it as failure or anything. So we try to identify the right emotion so we rightly know how to deal with it. Then understanding the source, like where it is coming from. It's very important for you as a person to know if I'm angry, why it's happening to me, from where it's coming, why it's coming, and labeling the thought. Like then use I statements, like communicating your feelings without blaming others. Like most of us struggle, and it's actually very easy to say that because of him I'm angry. Agreed, because of him you're angry, but why is his anger coming to you is something I try to make them bring into awareness. Then be specific. Coming to specifically why. We sit with whys and what so much that the client will be forced to confront themselves, which we all hesitate to do. That's it. And like to sum up, I'll just let you know like how we as a team work. When a client comes to us, Shilpika does the assessment, and I sit with parents to understand what has happened with the child. Like especially in context of children, we are talking here today. So we try to understand the birth process of the child, like what was the mother's state of mind when she was carrying the child, how was her pregnancy, and how was her delivery, especially like was it a normal delivery, was it a C-section, and did the child have the first cry, which is very important to note, and none of us like today's doctors really don't talk about it. And did the child have the first touch? Like today we more push the child first to clean up, which is not something we advise today's new mothers. Let the child be on the mother once it comes out of the womb, which is very important to have that first touch. And then we also ask simple things like whether the massages have been given to the child after birth, whether the breast milk was given to the child, did the child have allergies, how was the sleep pattern, even constipation. Like these are things nobody considers, but these are very important for us to understand how is a child from like the of the child is known through all these smaller aspects. Then once we understand what are the difficulties the child is having, depending on that, we tailor-made like do they need extra lesson with ILS, or do they just need extra lesson, or do they need ILS and art therapy, and how and why it's important for parents to take some counseling sessions with the therapist is here I'm working with the child, and if the parent is not unwinding their own fears and trauma with the child, then there's a very easy chance of child reflecting the same. So that's why we advise parents to sit with us and get themselves educated about what and why what is need to be done, so that it helps them to not to go back. So that's how we work, and open to any questions if anybody wants to answer.
I would add one last thing is nobody is normal. We all have difficulties. So either we are hypo or hyper. We all have to get into the center, understand what and how you go through and what happens to you. So everything what we do is without judgment in a very holistic way, where the child or an adult does not know that what we are doing, and it's very simplified with giving gut help, sleep, food changes, behavior changes, working with the parents or the adult who's coming through all the requirements what are needed, and other helps. Of course, homeopathy is part of my first preference, where it's very easy to use. To be very frank, if I have to use it with child, it's very convenient, and for an adult also to carry it in a pocket, and it's easy to use it. And thank you so much for giving us an opportunity for speaking about us. It, thank you. Thank you. Thank you for joining.
Thank you, everybody. Thank you.
If there is any question from the audience side, you can please post to the speakers right now. I'll be passing the mic to you all. Does anyone offline here have any questions? Meanwhile, sir, can we see the Zoom question? So we have a question in Zoom from Dr. Pallavi. Is there any enough evidence on this therapy, either in India or abroad? Does any authority approve this one?
So I would share detail on all the things from extra lesson to ILS to art therapy and biography. It has been researched, and there are various colleges which have been using. Abroad, it's very common to see all this in hospitals. For India, it's very new, and we are just pushing it to work in different places now. So for in some time, I would be joining few hospitals for working along with them. Till now, we have just done with colleges and one-on-one schools and trainings with them to understand when and how. Did a lot of one-on-one, but yes, opportunity of coming into hospitals is coming up. And I would share a lot of details and the research to the concerned person. Thank you.
Thank you, ma'am, for clearing the doubt. Any more questions? You can just raise your hand, so I'll get the mic. Thank you, ma'am. Thank you to all the speakers.
Thank you to all the speakers.
Hello. Hello. Now, I request Dr. Venugopal Gauri sir to please come onto the dais for the concluding remarks and vote of thanks.
I request Venugopal.
Good evening to Shilpika Turakhya ji, Ketan Turakhya ji, and Krishna Priya ji for that wonderful session on ILS, extra lessons, art therapy, craniosacral therapy, and also understanding the biography of the patient to help them recover through certain issues. Indeed, Hahnemann in his Organon of Medicine has clearly stated that whatever does not interfere with the flow of thought of rationale of homeopathic medicine, whatever helps in accentuating the result, whatever helps in seeing that the patient gets better earlier than before. And if it does not interfere with the our mode of therapy, that is the best auxiliary method to see that the patient gets back to the road to recovery as early as possible. Indeed, uh, Krishna Priya ma'am was talking about her personal story. I'll also tell a personal story about the way I connected to this good team of therapists. It's not something which personal doesn't mean that it has worked on me or on my family. It doesn't mean that the whole world is Vasudhaiva Kutumbikam, so all our people, so our karma is probably entwined. So there have been a lot of patients who have been taking help from these therapists before. In fact, they came to my clinic and explained how well they have been before and after. It was a child of autism, a young parent, who was confronted with this daunting challenge of autism and not knowing how to go ahead with the solutions. Then I found that they spoke about how well the child has reduced as in terms of restlessness, in terms of hyperactivity. Now that the child is able to sit at one place and he is able to adjust to a normal school. That is how I came to know of this therapist, and I took the number from them. I happened to refer a couple of cases to them, and after speaking to them, understand what they can do to help this child. And it is how this journey of about 8 years has started for me with these therapists. What we have seen in our patients with autism, with our tarantulas, Alzheimer's, valerianas, and so many drugs, if we can integrate these therapies where the child is made to, understand his body. We have a lot of sensory issues with the children with autism. That is because, as Krishna Priya ma'am was saying, externalizing the situation, and they do not understand whether that sensation what they are going through is a normal, abnormal, it is their own, or outside the body, extracorporeal, something like that. So when a child is made to be aware of his own body, sense of touch, hearing, uh, feeling emotions in the days to come, that is when the child gets back to the path of normalcy quicker. So that is how I found that these therapists have been helping the children with ILS, and later on with the art therapy too. And Turakhya ma'am has gone all the way to Switzerland to uh, improve upon her skills, or add more feathers to her cap, I should say, to upgrade her skills, and she's been able to help more patients. And I should not name the gentleman when talk about patients. So one elderly gentleman, a homeopath, so he had a stroke and he was suffering from the trauma of facing the challenge. And I requested him to come along with me to Ketantu Rakhiaji, and he found a lot of stability in his emotions, in his approach, and the way he could tackle with his illness at that point of time. I've seen that. I've understood from the patients who have been treated by Ketanji that with craniosacral therapy, that there is a stabilizing of fluids probably in the cranium, as they call it, craniosacrum. And that is how the patient is more relaxed and is able to face the illness better. The trauma is relieved that much more better. It doesn't come in the way of our arnicas and natrum cells and whatever, but still it does go a long way in helping our patients. And Krishna Priya ma'am, as I was saying earlier too, uh, we know about the conventional uh, psychology. And most of our case taking is probably trying to get to the root of it, trying to understand where this probable disease has started, say an autoimmune disease. What has happened in your childhood? What happened after your wedding? What was your state of mind during your pregnancy? These are the things that we usually confront our patients with. And apart from the conventional thinking, their thinking is that
you have to confront them, as she was saying, with more whys and whats, and understand, come to the root of the problem. And I really appreciate the way that has been biography has been understood and related to by them, as far as every 7 years of life is concerned, and how the emotions are during that part of time of their lives, and how they are in the long course of their life journey has an impact on their youth, middle age, and probably into the old age. In fact, kudos to all these team members for working on such a beautiful therapy. And there was a question, yes, understandably so. We are a scientific system of medicine today, wherever the rationale matters and how it has been checked and tested by others matters. It is not Venugopal appreciates their job, so that means it is researched. So there have been a lot of work that has been done on this. In fact, homeopathy is a very close cousin of such a therapies, because that is where we involve more of the symptoms of the mind or the effects on the mind to understand the course of the disease and also approach a remedy. So Rudolf Steiner, as Madam was talking about, so this kind of thinking was present from the time of our founder Hahnemann. He was vastly influenced by this mode of thinking, and that's the reason why most of the things, when they approach a disease with the symptoms of the mind, matches with what they do. So there has been a lot of work that has been done. There have been a lot of research articles that have been done. So I'm not sure if it is double-blinded, randomized studies. Nonetheless, there are so many studies which have shown the results before and after. That is enough for a rational thinking physician to appreciate and accept those therapies into the modern medicine, world of modern medicine. And we are all aware of how challenging these conditions of autism, ADD and ADHD are, and how much of a trauma that has been to the parents of these children suffering from these ailments. So if we can offer something, a bouquet of therapies that can be of help to the child, and as they say, it needs a village to treat a child of autism. So you need more individuals, you need more bouquets or flowers of therapies, and as Madam would say, colors to be accepted in this mode of treatment. And if we can help these children, as the numbers are growing by as the days go by. I remember Davidson's textbook of medicine did not have anything written about autism in 1992 when I was studying my final year of BHMS. But today, probably Davidson will have to print a book on autism. So the landscape of disease is vastly changing, and more so in such a challenging situation. It is our duty as a physician, like what our founder Hahnemann has suggested and insisted upon, that the auxiliary methods of treatment of any condition should be appreciated and taken into fold when we treat our patients. Thank you so much, Shilpika ma'am. Thank you so much, Ketan Turakia ji and Krishna Priya ma'am, for coming here and sharing your thoughts and experiences about uh, your therapies and how they can be of help in many a condition. Thank you so much. And it is also our duty at this point of time to appreciate them, at least with a shawl and a bouquet. I request the president of our association, Gopal Krishna sir, to come on stage, and the team of HMAT, Raghuramji, Savita ma'am, Ganesh Acharya ji, to come on stage and felicitate our speakers this evening.
Now we request Ketan sir to please come forward. Now I request Krishna Priya ma'am to please come forward.
I would like to thank the association who has given us the opportunity to talk about what we do. We are there for all the help and support, whatever we can extend from our end to any of the available physicians and doctors in city, or overall call also. Shilpika, Krishna or me are available. We can guide people who could be there for help in other cities also. So you all are welcome to reach us whenever they feel there's a need. Thank you.
Thank you, sir. Now I request everyone to please stand up for the national anthem. जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंधु गुजरात मराठा द्राविड उत्कल वंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जाहे तव शुभाशिष मागे गाहे गव जय दाता जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे जय हिंद.